Whether you're managing a chronic condition or just trying to make sense of your health insurance plan, understanding how your medication is covered is an important part of staying healthy and saving money. In the next few minutes, we'll break down what medication coverage means, how your medications are administered, and how both of those things affect your out-of-pocket costs. So let's get started. What is medication coverage? Medication coverage refers to how your health insurance plan helps pay for your prescription drugs. Each insurance plan has a drug formulary, which is the plan's official list of covered medications. Most formularies divide medications into pricing categories called tiers, and those tiers determine how much you'll pay out of pocket. Tier 1 drugs generally are the most affordable and typically include generic versions of brand name medications. Some insurance companies may have as many as 5 tiers and/or a specialty tier. Some medications come with additional requirements called restrictions. For example, some medications require prior authorization, which means your doctor has to get approval from your insurance plan before they agree to cover it. In other cases, you may need to go through step therapy, which means trying a lower cost medication first to see if it works before moving on to the one originally prescribed. And sometimes insurance plans place quantity limits on medications, meaning they'll only cover a specific amount of the drug at one time, like a 30-day supply instead of 90. If you're ever unsure about what your plan covers or what steps to take, reach out to your doctor, pharmacist, or insurance provider for help. Now let's talk about how medications are taken into the body, also known as routes of administration. This matters because it affects not only how your body absorbs the medicine, but also how it's covered by your insurance. One common route is enteral, which means the medication moves through your digestive tract. The most familiar method here is taking a pill by mouth, also called oral administration, which is typically the most convenient. Another major route is parenteral, which involves injections or infusions. These include intravenous or IV medications that go directly into the vein, as well as intramuscular injections, which are given straight into the muscle. Next, we have topical routes, and these are medications applied to the skin or to certain membranes. The route your doctor chooses depends on your specific health needs, how quickly the medication needs to work, and how well your body can tolerate it. But here's the most important part that we care about: the cost. The way a medication is administered can make a big difference in cost. Oral medications tend to be the least expensive. They're easier to produce and ship, so they're often on the lower cost tiers. Specialty drugs like IV medications can be much more expensive. They usually require sterile environments, temperature control, and must often be administered by trained healthcare professionals. That's why they often fall into the highest tier and may be handled by specialty pharmacies. Some medications must be given in a hospital or outpatient clinic. In those cases, your insurance may cover them under your medical benefit instead of your pharmacy benefit, and that changes how claims are processed and how much you might pay. Another important factor is understanding provider networks. Your insurance plan has a network of approved providers. This includes doctors, hospitals, pharmacies, infusion centers, and more. Why does this matter? Because if you get your medication from a provider that's not in network, your insurance may not cover the drug at all or charge you significantly more out of pocket. So always double check that your pharmacy and your doctor's office are in network, especially if you're receiving infusions or specialty drugs. Before we wrap up, let's just quickly go over what we learned today. It's important to check your plan's formulary to see if your medication is covered and to understand what it might cost. You should also be aware of how the medication is taken, since the route of administration can impact your coverage. Make sure you know whether your medication is billed through your medical or pharmacy benefit, because that can change how it's processed and what you'll owe. And finally, always try to stay in network whenever possible to avoid unexpected charges. If you ever feel confused or overwhelmed by insurance terms, you are not alone, and you are not out of options. Excelsia Health is here to help guide you, support you, and advocate for fair access to care.